There were over 95,000 tests yesterday. Our testing rates continue to be high, but regrettably we did have a substantial increase in the number of cases in the last 24 hours to 8 p.m. There were 356 cases of community transmission in New South Wales, and at this stage we understand around a third of them had some exposure in the community during that time. Tragically, there were 3 deaths related to the Delta strain overnight or until 8 p.m. last night, and of course we extend our deepest heartfelt condolences to all the loved ones of those 3 patients. One was a man in his 80s, one was a woman in her 80s, another was a man in his 70s. None of the 3 were vaccinated and all 3 died in hospital, and Dr. Chant will explain those circumstances. There was also an additional death, but that was resulting from a returned traveller from overseas, and again, our condolences to his family. That gentleman was in his 80s and we understand taken straight from quarantine, overseas quarantine, to hospital, but he was not related to the current Delta outbreak. Of course, regrettably, Canterbury Bankstown remains the central area where COVID is spreading, where the cases are increasing, and we have seen stabilisation and substantial decline in areas like Fairfield. So communities that are responding to the health orders and responding to what we're asking them to do are seeing a decline in their local government area. Pleasingly, there are no additional cases in Armidale, no additional cases in Tamworth, and the North Coast is investigating one potential additional case, but that's not linked to the gentleman that was in Byron. So Armidale and Tamworth, no extra cases at this stage, and potentially one other on the North Coast, but not related to the gentleman in Byron. Hunter has continued to have additional cases, and Dr. Chant will provide further information on request about those. Can I thank all the HSS students that came forward to get vaccinated yesterday? That was definitely a green shoot, knowing the young people came forward enthusiastically, nearly 3,000, and I understand we have the same number today. And I understand we have around 10 or 11,000 HSS students who've already booked for their vaccines, and can I encourage all those others who haven't to please do so. It's really important for those who are sitting the HSC exam in those local government areas of concern to make sure they have the vaccine, they're fully vaccinated by the time the exams come around. Again, we know that New South Wales is going through these challenging times, but we also know that vaccination is a key tool in reducing the spread and preventing hospitalisation, and it's always so sad when you hear about deaths, especially of elderly people who unfortunately for whatever reason weren't vaccinated, because that is proving to be an ongoing challenge. Those who have had 2 doses of vaccination have so far avoided any ICU, any mortality, but unfortunately those that are unvaccinated of any age continue to be vulnerable. And with case numbers where they are, unfortunately, if you live in those local government areas of concern, there is a high chance now that you could get the virus. Please protect yourself, your family, your loved ones, your community by getting vaccinated, whether it's through your GP, whether it's through the local pharmacist, whether it's through one of our New South Wales health clinics, whether it's through your local place of worship or community centre if there's a vaccination hub near you. Please come forward and get vaccinated. This is the time to protect yourself and your family and your loved ones. And can I again issue a plea to say, if you want to get back to work, if you want to get back to normal life, please get vaccinated. Vaccination is key to what we can do potentially in September and October, and I look forward to seeing those vaccination rates continue to go up. I assume that by today we're at 4.5 million already, and I'd like to see us get to 5 million by the end of next week, and then look forward to having the sprint towards 6 million by the end of August.